I'm Dr. Carlson at North Texas Plastic Surgery. I just wanted to take a few minutes to talk to you about breast reduction surgery. Some patients will present complaining of just having large breasts. Other patients will present with what's called symptomatic macromastia. That's a fancy term meaning that you are having symptoms due to having large breasts. Common symptoms that patients will present with are frequent headache, neck pain, back pain, shoulder grooving. Some patients will also complain of what's called intratriginous rashes, or rashes between or underneath the breast. All that is due to the weight, heaviness, and the moisture that is trapped underneath the breast tissue. From a plastic surgery standpoint, this is one of the most rewarding surgeries that I perform because patients report satisfaction rates that are very high because of the resolution of the symptoms that we just talked about. Patients typically come back to our clinic about a week to 3 weeks after surgery saying that most of their symptoms have significantly improved, if not completely resolved. This surgery is done on an outpatient surgery basis. That means that you as the patient can come in and go home the same day as surgery. The typical incision pattern that you're going to see with a breast reduction is what's called the WISE pattern, or anchor type incision. This involves an incision around the nipple areolar complex, a vertical component below that, and then a curvilinear portion below that. So like I said, people liken that to an anchor type incision. The purpose of this incision pattern is to allow the surgeon to raise the nipple areolar complex to the most projected portion of the breast while still allowing access to removing the breast tissue to give you a nice shape to the outer and lower portion of the breast. Now, one of the key components in this surgery is maintaining good blood flow to the nipple areolar complex. A common question for the surgery is how much breast tissue am I going to remove? Some of that's determined on a case-by-case basis. Patients who have very large pendulous breasts, what I would tell them is usually about 60% of the breast volume will be removed. That 40% of breast tissue that is left behind is so that the nipple areolar complex has a healthy blood supply, and then also allows me to have enough tissue to reshape the breast to give you the most aesthetic result possible. Some patients will come in requesting a particular bra size after surgery. That's a little difficult because each bra manufacturer is a little different and each patient is a little bit different. There's different heights, weights, torso shapes. We have to take all that into consideration. But to help with that, during your consultation, we'll create some 3D images so that you and I can create a common image for our goal for after surgery. Patients will also typically ask about the recovery process from this surgery. Now, again, it's done on an outpatient surgery basis, so you're able to go home the same day as surgery. In terms of your activity level, I usually recommend that patients wait about 3 weeks after surgery to resume cardio, and then 6 weeks to do more vigorous exercises in terms of lifting heavy objects. Up until that 6-week mark, I ask patients not to lift more than 10 pounds. After that 6-week point, you can lift as much as you like. Now, in this surgery, there's no manipulation of the pectoralis muscle, and I also inject medicine to numb the nerves to the chest and the breast to help recover from the surgery more quickly. Now, you would think with the extent of the incisions that patients have a lot of discomfort, but because there's no manipulation of the pectoralis muscle and we use that numbing medicine during surgery, it's actually much more comfortable than you would imagine. After surgery, you'll wake up in our Pkwy recovery area. The incisions that we talked about will be covered with a glue that stays in place for about 2 to 3 weeks after surgery. Before you wake up, we'll apply a soft bra to help provide support for after surgery. You'll wear this bra for about 6 weeks after surgery. Now, the important thing about this bra is it doesn't have an underwire bra component, so there's no rubbing on the incision that we just created during surgery. That allows that incision to heal without less tension and less friction to give you the best aesthetic result possible. If you have any questions about this procedure or any other procedure, don't hesitate to reach out to us. Our website and phone number are listed below. If you like content like this, don't forget to like, comment, or subscribe below.